Good morning, good afternoon, good evening, wherever you are. I'm Dr. Lynn Smith, and this is another edition of My Political Faith. I must begin by giving a shout out to our CEO and founder, Dr. Jacqueline King, Black Women Empowered. We are so grateful for this opportunity to come and to share. For those of you that don't know, Black Women Empowered, our motto is empowering the world through the ministry of Jesus Christ. And that is exactly what we attempt to do. I'd like to encourage you to be a supporter of Black Women Empowered. You can give knowing that when you give, our gifts are aiding those who are in need. Women and children who are in need, that is who we target. So once again, to Dr. Jacqueline King, I must give a shout out to you, and I'm grateful for this opportunity. Well, today we have certainly a wonderful show for you. We have a wonderful man who has gotten his, as we say in the church, his learning and his burning. And he's going to share today some information about this coronavirus that is seeming to take over the world. So won't you welcome my guest today, Dr. Dwight Owens. Dr. Owens, I'm so glad to be here. I'm just going to give you the elbow bump. Okay. Because of all that's going on and because of all that's being said about the coronavirus. So would you begin today by telling our audience just a little bit about yourself, what you do, how you got into the medical field, so forth and so on. Share.
Well, I'm a native of Atlanta, did my undergrad work at Morehouse and completed medical school and in Syracuse, upstate New York, and came back and I did a year of family medicine actually in Macon before going back to upstate New York to do psychiatry as my training. And I completed forensics at Emory here in Atlanta. I'm currently practicing psychiatry in downtown Atlanta using an integrated approach where we look at both the medical needs and the behavioral health needs of a lot of our patients. And we here use the biopsychosocial spiritual model. So we do pull on that part of our patients, the spirituality part of our patients, to help them as they endure some of those traumas that are involved in life.
Great. And just so you know, audience, we're going to have him back and we're going to talk about mental illness. But today, I'd like to really talk about this coronavirus. And so I'd like to ask you, when did the U.S. recognize the first case of the coronavirus?
According to the CDC, in January 2020, that was the first official case that's been documented. It's very important to let people know that the number of cases being identified are increasing. I think some of the panic is that when the CDC sends us a number and it goes across the television, 200 more cases, 300 more cases, people get very alarmed. But know that the test availability is what has to also be included. Initially, there was no test, but now the test is becoming available. We're trying to make more tests available. So you are going to see a spike in the numbers. So you can't be too alarmed by the raw data.
I guess that makes sense because if you go with no test, suddenly have tests, of course, that is going to spike the number. So that's good. That's really something good to think about because I had not thought about it like that. And so now we go from no test to test. So of course, the number is going to increase.
Right. And also it's important to note that we're only testing people that screen positive. So if you screen positive, more likely so than not, you're going to have a positive test. So everybody who's being tested, more likely so than not, has the virus. So all of your numbers are going to go up. But what we're trying to do is maintain the area under the curve to prevent the really, really vast negative outcomes. So you're going to see a spike in the numbers, but don't be alarmed. I think there's about 66 deaths in America. We're doing a very good job. We're trying to contain and mitigate. We're trying to keep the number of people that actually have the vector or the virus kind of under control. We're treating these people and they're having some very positive outcome. We've treated over 75,000 people and they've done well. 80% of people with this disease do well and they live a normal life.
Let me ask you this. So the people that died, they primarily died because maybe they waited too long or their health was already in such dire states that this disease just overtook whatever else was going on in their bodies?
What the CDC has said is that There's some risk factors. Elderly and persons with what we call comorbid illnesses, diabetes, hypertension, of course, any type of lung disease. As you know, the COVID virus, what it does is it causes fibrosis of the lung tissue. So if you have any kind of disease like COPD, asthma, or something pre-existing, and you get this particular disease, it's a problem. Also, people who fail to get the flu shot. Having flu and COVID-19 is just not going to be a good mix. So stay healthy, and be prayerful.
Let me just ask you this. So the flu shot, a lot of people haven't gotten the flu shot because it's been documented and seen that those that get it get sick from getting the flu shot. So it's a deterrent. Can you speak to that? As I'm one of those, I have not had the flu shot.
There's a lot of myths around getting the immunizations, but I would really, really encourage you. We're now I think there's an announcement that they're about to make about working on the vaccination for COVID-19. When it comes to vaccinations, when it comes to anything that's going to help with immunization, whether it's the influenza shot, MMRI, I would encourage you to have a very frank, clear discussion with your physician. If you don't trust your physician, find another physician, someone who you can have a good discussion with. Oftentimes when people get a flu shot and they say they had a reaction to it, they got sick, they probably already had some symptoms that they weren't sharing with their doctor. So really, it's a good time to get the flu shot is when you have no active symptoms. Now, can I promise you that you won't get sick? No, I cannot promise you that.
Come on.
But for the most part, when we give you the flu shot, it's safe and it's efficacious.
Thank you. That does clear up some things. So how might a person possibly differentiate seasonal allergies from the possible coronavirus?
Now, with the coronavirus, one thing that we've talked about is the fever and the non-productive cough. Now, seasonal allergies, I think, if you live in the South or anywhere where there's high pollen, high ragweed, you're going to have the sniffles, you're going to be having rhinorrhea, what we call some little postnasal drip. So you'll get more of those symptoms. You don't tend to get as many of those, the postnasal drip, the kind of wet cough with the COVID-19. It's going to be more dry. So that's one thing to look out for. So you want to be kind of watch out for that, because we do know we're entering into spring. Spring starts, I think, is it this week or next week? So you're going to have more pollen, more ragweed, more seasonal kind of allergies, and watch out for the shortness of breath. You can't have shortness of breath. If you have asthma, you know what that feels like. But if it's something that's very, very different, or your body feels different, please call your doctor or look at some of the screening questions for the COVID-19.
Thank you. What is your position on the current review report, such low rates that has been reported among people of color? We've heard, hardly any people of color have gotten it. Speak to that, because I just am so curious to hear.
So when you look at the data the last data that was presented, I think maybe yesterday, you look at the U.S. Virgin Islands, that's just one case. Jamaica, some of the other places where you have a large populace of people of color, you don't see a lot of documented cases. The data is not out yet. This is a myth. This is a rumor that there's some genetics that people of color have, but we don't have hard tested data that says that there's some immunity or there's something that we have in our systems that protects us from the COVID virus. Therefore, you have to wash your hands, social distancing, all those things that are being talked about in the media, all those things, teleworking, all those things you're going to have to do. There is no data that would suggest right now that people of color are immune against this disease.
So do you think, we're in the Georgia area, they're shutting down schools, they're closing some of the restaurants and changing the curfews. Do you think that it's going to get worse before it gets better, or is this just people blowing things out of proportion?
I think,
in your humble opinion,
I think that the word worse is what you and Dr. Falsey, our chief infectious disease doctor in America, use. I think we are going to see more cases.
Only because now we have the testing available.
We have the testing available, and we're going to see more cases. How they will manifest, I think that what we're trying to do with the mitigation and the containment, we're trying to control the vectors. Right now, we don't know who all carries the virus. Now, you have to keep in mind there are different strands of corona. There's some very mild strands and different strands of the cold. So what we're trying to do is contain the vector. If we can contain this thing, then I think we can get it under control. And you hear a lot of talk about the area under control. We're trying to get beyond the big curve and keep it in the little curve. Getting worse, I think there will have to be some more mitigation. In all honesty, there will have to be more cases identified. Will there be more panic and hysteria? I think there's going to be a little more, but I think that this forum, the more education, the more training, the more teaching, the better it will be for people. Because when you hear words like the numbers are increasing, it's going to get worse. What do we mean by it's going to get worse? I mean, that word has a large connotation. But if you think about it, relatively speaking, in America, the number of deaths are still pretty low.
That's true. I'm going to throw you a quick curve. This virus, I've been doing a little reading. Did it really originate from bats or bat blood, bat urine? Is that something that your studies have bolstered and talked about? So where did it come from?
What my reading is moist areas where there were animals.
Okay.
That correlation. And that was something about a bat and something somewhere. But animals and moist areas seems to be where a lot of the studies show that this originated.
I just want to know, and you don't have to answer it, but who eats bat anyway?
Well, I think if you look at some of the other areas where they have open markets,
yes,
then a lot could take place in an open air market.
Okay, we won't go into that this time. That'll be our next time that we discuss this. All right, my last question for you is this. Should the church, if any, take a position during our current state of affairs?
I think that at this moment in time, the church will have to take a position. I think oftentimes we take our position after the fact.
A day late, a dollar short.
But I think this time we will have to become very forward and very directed in how we're dealing with parishioners, how we're dealing with the concept of prayer, how we're dealing with our relationship with God. That has to be very, very directed. I think in my denomination, which is yours, we had a National Day of Prayer last night. So it's going to have to be very almost mitigating. It's going to have to come out how we're going to deal with this. As you know, the CDC said on yesterday, crowds above 50, that's most churches. So now most spiritual services will be online. But in the meantime, when there's panic, when there's anxiety, I think the leaders of the spiritual community of churches, denominations, they're going to have to come out. They're going to have to make a statement. They're going to have to talk their parishioners through this because it is a crisis.
It is certainly a crisis. And the one thing that we have to also be mindful of as people that are spiritual is that we cannot allow what the government and or the CDC is saying or dictating to affect our faith. Yes, we have to be mindful to wash our hands, be mindful of social distancing. Those things are important, but that does not change the fact that we serve a God that saw this coming even before it came. And we serve a God who is able and willing to take care of us no matter what. We heard and we saw as we read in the Bible of all the pestilence things that took place, but we know that God was in the midst of it. And so just like God did it for them back then, we know that God will do it for us right now. Before we close, I'd like to always give my guest an opportunity to maybe say something to encourage our audience. If you'd like to invite anyone to know Jesus Christ, that is certainly available as well. But just your closing words to us as we bring this to a close.
I want you to remember that there's a lot happening right now, and we're taking the lead definitely of the president and his cabinet. But remember, the scripture tells us that the government shall be upon his shoulder. And in the midst of all that we're hearing, always remember by his stripes we are healed, in the past tense. There's nothing that says we have to go through a process, but we're already healed. So if you accept that word, you believe that word, and you take that word, you'll move through this crisis and you'll come out a winner. In the end, we win.
In the end, we win. Dr. Owens, thank you so much for this opportunity.
Okay.
I appreciate you so much. And to you, our listening audience, this has been another edition of My Political Faith. I'm Dr. T. Lynn Smith. God bless you.